Good evening. India has vaccinated close to 80 lakh beneficiaries against the coronavirus in the last 28 days. On February 12th, which is day 28 of the vaccination drive, 4,62,000 beneficiaries were vaccinated, says the government. The second dose of the COVID vaccine began being administered this morning to all those who took the first shot on day one of the nationwide inoculation drive on the 16th of January. And India, remember, has set a target of inoculating 30 crore people against COVID-19 by July. India took just 28 days to vaccinate over 70 lakh people, while it's taken 27 days for the US, 48 days for the UK to reach the same figures. That's what the Health Ministry had said earlier. So where do we stand in the fight against the spread of the coronavirus right now, and what do you need to know to protect yourself and your loved ones? Well, joining us tonight on the show, none other than the Director of the All India Institute of Medical Sciences, Dr. Randeep Guleria, to take all your questions. Dr. Guleria, thank you for your time again. Dr. Guleria, you and the Niti Aayog's Dr. V.K. Paul were among the first to take the jab, and you did so publicly. Have you taken your second shot, and how did that go?
So I've not taken my second shot today because I was out. So I plan to take it early next week, in the next 2-3 days. And I'm looking forward to that. And then I'm sort of looking forward to having protection as far as COVID-19 is concerned.
No, so that means, as you're clarifying for all our viewers, that you don't necessarily have to take the second dose on the 20th day after your first dose. Is there a window or a time period? Like, how does this work? What do our viewers need to know who've taken the first shot?
So in an ideal situation, you should take it on the 20th day. But for some reason, if you have to be out on the 20th day, you can take it even a few days later. And that provision is already there, that for some reason, for health reasons, or even for other reasons that you couldn't be there on the exact 20th day, you could even take it on the 29th, 30th, 31st, or the 32nd day, as long as you take it as early as possible.
Okay, but you must take it. There's no avoiding it. Yes. And is it harmful if you don't follow up with the second dose? Like, I mean, is it something like antibodies where, you know, it could harm you if you don't finish the dose?
So, so there are two things. One is, will it protect you? So if you don't take the 2 shots, as per the studies which have come out, the degree of protection is not good enough.
Okay.
And therefore your antibody response will not be that good, because the first dose is what we call the prime dose. And the second dose is the booster dose. So it's a prime boost vaccine. So you prime your system by the first dose, and the second dose is the booster, which really gives you that extra push as far as forming the antibodies is concerned. Therefore, getting both the doses are important. It's not that if you don't take the second dose, you'll have some different side effects that you could get. That is not true. But the other important thing to remember is that your protection is not complete, and therefore you may be sort of prone to getting more serious infection.
And what about people who've had COVID-19 coronavirus? Because France on Friday recommended that those who've already recovered from COVID-19 infection receive a single vaccine dose, and they've become the first country to issue such an advice. And I ask that because we have so many millions who've had COVID in India already.
So there is some data emerging that suggests that one shot may be good enough. We need more data. But like I told you for the vaccine, it's like saying that the infection was the priming event, and the first dose of the vaccine that you took was the booster event, and it gave you sufficient boost to have antibodies which are long lasting and sufficient. So that is also being propagated, and some data suggests that those who've had the infection in the past, the first dose of the vaccine gives them a very nice antibody response, and good amount of antibodies are formed. Therefore, it may be sort of possible that you may not need to take the second dose if you had infection in the past. However, having said that, we need more data, and we must understand that everyone's immune system behaves in a different manner. So some people may mount a very good immune response, others may not, and the duration of your COVID infection may also make a difference. Remember, this pandemic is now about a year old. So we may have individuals who, let's say, had COVID in April and May. By this time, their immune system may have waned, and therefore it may be better if they took both the shots rather than taking one and taking a chance.
And that's why you have said on this show in the past that you recommend that everyone who's even had COVID-19, they should also still go in for the vaccination. You're repeating that, standing by it.
Correct. It's a safer option. The option that is being offered in many countries is basically looking at the number of doses that they have and trying to spread it out as much as possible. But from an individual point of view, I would say that if you can, you should take both the doses.
All right. Now, I want to move on, Doctor, to the other big headline of this week when it comes to those who follow the spread of the coronavirus. Now, an Oxford COVID vaccine is being tested or is to be tested on children for the first time. Why is this? Because we started off over the last few months, we were told no vaccine needed for kids. Then why is there now like this new mid-stage trial to determine whether the vaccine is effective on people between the ages of 16 and 17? And, you know, my question as a mother would be like, who would submit their children for human trials, which is what is needed for a vaccine?
So whenever we start a trial, the first phase is usually looking at adults, and two groups that get excluded are children and pregnant women, because one is not sure how safe the vaccine could be in them, especially children who are growing. And once you have good data from the vaccine from the adults, you then start looking at vaccination for children. Now, it's important that we look at vaccination for children from 2 points of view, and we've been saying that in the past also. One is that we will start opening up schools and colleges, and children will start going to schools and colleges, and most young people are not that aggressive in following. For young children in school, I don't see them being able to sort of maintain physical distancing, wear a mask. There are times when children have actually exchanged masks among themselves. So there are issues that will promote the spread of infection when schools open, and one has to be very careful about that. Secondly, the concern is the children may get infection. They'll have milder infection, but they may carry it home and give it to their parents, grandparents, and they may get a more severe infection. Therefore, at some point in time, we will have to look at vaccinating children, but we need to get data which gives us confidence that they are safe. We will have to look at limited studies because we already have a large body of data in adults, and we have to just see that we can look at safety signals as far as children are concerned.
All right, I'm glad you brought this up because this is the big question on everyone's minds, doctors. Should schools reopen or not? That is the big story of this week. Schools across India have been shut since mid-March 2020. This is in view of the COVID-19 pandemic. Students have lost a year of their school lives, their academic year. Digital school, you know, is not accessible to all. Many from low-resource communities are disadvantaged. Now, for viewers joining us, let me just give them the big picture. Delhi schools have reopened after a 10-month hiatus. The Delhi government has allowed schools to reopen for class 10 and 12. This was on the 13th of January in order to help students prepare for the board exams. Now, after a gap of 11 months, schools in West Bengal reopened on Friday from classes 9 to 12. They say with strict adherence to COVID-19 protocols. In Hyderabad, schools have reopened. The Gujarat government today announced reopening of schools for students from classes 6 to 8 from the 18th. Now, all these schools are saying attendance will not be compulsory for students, though all 9 classes will also continue. But schools are reopening. Doctor, parents are in a dilemma. They have to make a tough decision, possibly one of the toughest decisions. Should they send their kids to school or not? Now, later, when? How do they evaluate the pros and cons? Your advice, please.
So I do agree with you. It's a tough dilemma because you're looking at two broad things. One is the risk of the child getting infection. The second is, like you rightly said, there's been a big loss as far as education is concerned. And I'm not saying that the education through online was bad, but that's not how school should be. It's not only the online training that is important for children. It's also important to have a social interaction, character building, meeting friends. And that is also part of childhood, which for 1 year, a lot of children have lost. As a matter of fact, I remember one parent telling me that their child now thinks that the school is only staring at the TV screen, at the computer screen. And that's all school is all about. And this is a child in the KG or first class. So children at that age have sort of lost or have a different concept of what school is all about. So it's a balance that we have to do. It seems that currently our cases are really down and the infection rate is low. And therefore, one has to try and see what is the risk-benefit analysis and look at that. it seems that the risk is low, but I would really have one caution that we need to do this with very close surveillance. If you are going to open schools, we must have a very good close surveillance for any child who has flu-like symptoms. A protocol should be placed in place so that any child who has symptoms like that should not come to school. There should be some degree of availability of testing if that is required. We could do the rapid antigen test if it is needed. So if we develop a SOP, I think at some point in time we will have to open schools, because it's been already, like you said, more than a year or almost a year, the schools have been shut down.
So, and there's only so much that the school can do. So, parents also have to take responsibility. But I want to, establish one thing, Doctor. This is not just in India, right? This is happening globally. The US Centers for Disease Control and Prevention, that's a top US health body, says schools can reopen. They've issued COVID guidelines. Their strategy emphasizes universal masking, hand washing, disinfection, contact tracing. But, it spends, I just read it before coming in to interview you, it spends relatively little time on the subject of ventilation, right? Because is this the main transmission route for the virus? Because in the end, students study in a classroom.
Ventilation is very important, and like I had said, we need to develop an SOP which is more Indian based. How do we do it in our setup, considering our constraints and the things that we can do? But ventilation is very important, and as we move into schools opening, there has to be good cross ventilation. There is a lot of data which suggests that if you have aerosol generation and the ventilation is not good enough, the chance of infection are much higher, and therefore good cross ventilation should be actually also something that schools need to look at. Sometimes I feel that having a class under a tree is probably the best thing, because that is the best way to really protect oneself from the infection. You have a nice cool breeze blowing and you may not have a chance of any exposure.
Another reason for all of us to not cut down trees in our country. But Doctor, you've touched upon this, so I just want to ask you more in depth. What about parents who live with grandparents? They're stuck between a rock and a hard place, right? I mean, it's different for nuclear families, but there are still many in India who live in joint families. What do they have to keep in mind? Because you said children, are they carriers? Aren't they?
This is a big dilemma, and this is not only now, it's been there for the last 1 year, not only for parents and who's having grandparents are living, but even for healthcare workers. Many healthcare workers come from joint families and they work in the hospital, and they're all worried that they may carry the infection and give it to the grandparents whom they have a very close bond with. So this is something that we need to develop, and that's why COVID appropriate behavior, even at home, needs to be aggressively followed, whether it's hand washing, wearing a mask, and making sure that exposure is not there, or the house is properly ventilated. Those practices we really need to continue to follow. Unfortunately, in many cases we have let our guard down, and that is a cause of concern, because we are in a good position, but it could change any time, and therefore we need to be really careful.
Okay. And we talked about senior school students. They have a greater academic loss, or much more to lose academically. Every day they skip school. But what about nursery school? Because their learning graph may not be steep, but as you point out, they need socialization. So our younger children we talk about, because the vaccine testing is from 6 onwards. What about nursery school, grade 1, grade 2? Are they at lower risk than older children? Should those classes be prioritized and opened first?
So nursery children, nursery school going children are likely to have a milder infection, but we really don't have a vaccine for them, and it will take a much longer time for that to come out, because that will need more regulatory approvals, and therefore one has to be careful. Again, I think one will have to go by a symptom-based approach, and trying to see that those children who have flu-like symptoms, who seem to have COVID infection, are isolated properly, not only from coming to school but also at home, so that they don't spread the infection to others.
All right, Dr. B, I dare sum up. I think what you're saying, kids are not likely to be commonly infected with the virus, but could there then be a problem of the staff, the school, the teachers, etc., who are also at risk then?
That is there. There is always this problem that the teachers could be at risk. There have been instances where a large number of teachers and school children have got infected, and this is always a cause of concern. This has happened even once during our H1N1 pandemic. I remember at that point in time in Pune, a boarding school, there were a large number of people got, students and the teachers got infected. So we need to be extra cautious, and I think the same precautions teachers need to take. If they have any symptoms, please get your self-tested as early as possible. Please isolate yourself, and remember that you have a bigger responsibility because you can spread the infection to the children in your class.
And vice versa. But teachers do have the hardest job, selfless job that they do. Dr. Guleria, let's go in for a quick break. We have a few more questions. If I could just take more time, but after a short break. Welcome back. We're in conversation with the director of the All India Institute of Medical Sciences. Dr. Guleria, India's apex drug regulator has given approval to Bharat Biotech this week to start clinical trials of an intranasal COVID-19 vaccine candidate. Why is this important? Could this be a game changer?
Yes, in many ways it could be a game changer. We had an intranasal vaccine also, which was a live attenuated vaccine for influenza also. So it's much more easier to give. So we were talking about children. If you have a vaccine which you just need to give a nasal spray, you could spray a large number of children, the entire class for that matter, within a few minutes by just giving them a spray in the nose. And that's all that was required. The compliance would also be very good. It will be very well acceptable among children. And therefore this vaccine, if it is successful, will be very useful. Some people and suggest that this may actually be more effective if it works out, because it will also produce some degree of local mucosal immunity. So when we spray it in the nose, it's the exact site, it's the site where the virus first starts, and it may also stimulate what we call local mucosal immunity, along with the antibody response and the cell-mediated immunity.
And not to mention disposal of needles. This pandemic has created another problem of, waste disposal, medical waste. Doctor, this week threw up another, oddball question. But this visual has been doing the rounds of these white tiger cubs in Pakistan. I don't know if you saw them, and they're saying, authorities say they died of COVID-19. That's what the zoo officials are saying, because there was an autopsy that showed lung infection, etc. So again, we go back, animals can contract COVID but not transmit COVID. Are the studies out on this?
So we've had some studies in the past also. I remember many months ago there was a report also from New York Zoo where the tigers and the lions had got COVID from the zookeeper who was positive, and they had been tested and had become positive, and it was felt that the virus had jumped species and gone from the humans to the animals. The reverse is not really true as of now. That's not been really proved. But we know this virus can jump species. That's how it's come to humans. And therefore, that is possible. But we need really more data in terms of an analysis to see how they got the infection.
All right. And now more and more physicians, public health officials, they're warning that even with the mass rollout of vaccines, COVID may become an endemic. What does that mean? We're hearing that that being used, I'm seeing it in headlines. What does that mean then?
So currently we are worried because we call it a pandemic. Once we may have a situation when the number of cases become very few, but they don't become zero. And therefore we will continue to have a few cases off and on, like we continue to have few cases of swine flu. They become more during the winter months, they become less. And it becomes like any other illness that we continue to see. So in our list of respiratory viral infections, COVID-19 will also get added as to one, and we will need to then manage it as we are doing for other infections rather than treating it like a pandemic. We will have it on an annual basis and treat it regularly, but the numbers will be small and we won't really need to have specialized facilities for managing these patients.
All right, we're out of time, doctor. So last question, Delhi's positivity rate is now in below 1% for over a month. New cases and deaths due to the infection are coming down across India. But is there a but? Do we have to continue to, take precautions? Your parting shot tonight.
So I'd say we are in a very good position. As a fact, the whole nation and Delhi has shown a very good response in terms of the number of cases. Our recovery rate is high, but as you rightly said, we are very worried about the variants. We've seen what's happened in Brazil, in the city of Manas, and there are a number of new variants which are being reported. If they really come to India, and then there's always a concern that do we have enough protection? Can these variants cause reinfection? And therefore, we need to really continue to have COVID appropriate behavior as we go along, because that's what will really protect us even if we have a variant.
All right, closing words from Dr. Guleria. Thank you so much for your time and joining us tonight.
Thank you.